Practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Living a Longer and Healthier Life show. We're going to be talking tonight with Doctor's House Calls. We have Seth Levy here. He is MS, HFD Ph.D. with Doctor's House Calls. He's going to be joining me this evening as we're going to talk about a lot of primary care on this show, which is oh so important. So without further ado, welcome to the program. Seth Levy, how are you doing this evening?
I'm doing great. Thank you, David. It's a pleasure being here, and thank you for inviting me. So there is no confusion. My name is Dr. Seth Levy. However, I am not a physician, and I don't play one on TV.
That's a true story. I've heard that before. I like that. But let's get started a little bit. Tell us a lot about Doctor's House Calls. So
Sure.
I kind of just touched on it with primary care, but you
Sure.
do so many other
So
things.
we are a 100% mobile physician group that services patients in all Broward, all Palm Beach, and the entire Treasure Coast. We go to patients in assisted living, independent living, and one of the few that also go to patients in their private homes. We are primary care, so there are many, many different types of patients that see us. We are basically like any other doctor's office anywhere, except we go to people instead of people schlepping to an office. So we can see a patient in assisted living and independent living in their private home, in an office, a hotel, wherever they need to see us, we can go. So there are many reasons why people use us. Let's say you have little Mrs. Smith that loves her doctor, never wants to leave her doctor, but she just broke her hip, she can't get out for 3 months. We'll actually go out, see her, and get her back into her regular doctor's office so they will get them back sooner than if they weren't seen at all. Or someone says, you know what, I'm tired of sitting in the doctor's office and getting 5 minutes of care, and I want you to be my primary care. So we can also be their ongoing primary care. You know, David, you're a young, handsome guy. You're pretty healthy and all that. You get a cough or cold, no big deal. You run over to a drugstore, maybe you run to the doctor once in a while. However, again, my little patient, Mrs. Smith, gets a cough or cold not seen in a timely manner, then that could develop into something much more severe. So that's why we like to see our patients on an ongoing basis, so that little thing never becomes a big thing.
That's a great point. Yeah, it's for me, being young, like you point out, it's convenient. You know, I can get in and out of the house, but someone who's older definitely can't. And I like another thing you touched on. So you can be the in-between primary care if they have a physician that they really like, but they can't get to. However, you could also, if they really like you, you know, you could also offer your primary care services.
And we can actually be an addition to anyone's primary care. So we know, for instance, statistically, that most doctors have a census of anywhere from 5 to 15% of patients they're not seeing for various reasons. Transportation, ambulation, too sick to get out of bed, non-compliant, whatever it may be, we can actually go out there, see them, and get them back into their regular doctor's office, and they can go back to regular. Also, you know, the average doctor today, sadly, doesn't have a lot of time. The average doctor today has about anywhere from 5 to 8 minutes to see a patient. For us to see a patient, our average time is anywhere from 15 minutes to a half hour, and sometimes even more, an hour or so, with a new patient. So we're really able to give the time and respect that a patient actually deserves. Also, by going into a patient's home, we can really see what's going on. You know, I just talked to their doctor, Dr. Bob, and they're doing everything right. They're calling and seeing how she's doing. You taking your meds? Are you eating right? Yeah, really. We just got to the house, and drugs are still sitting there from 1966, and I opened up the refrigerator, and she's eating cat food. This is no dispersion on any doctor in any office, but there's no doctor in an office that knows what we know.
Yeah, it does happen, especially as people get older. Sometimes when people are living by themselves,
Most definitely.
Family gets busy. You know, friends, acquaintances get busy. Don't drop by enough.
Yes, sir.
Especially this time of the year, right?
Yep.
Everyone's busy.
This
trying
time
to get
of
ready.
year gets worse, and even in the 2000 census in Broward County alone, there was over 85,000 homebound and bedbound people, and that's one county more than 15 years ago. So you can imagine what's out there today.
Yeah, because we're growing so much.
One other important factor to say, as I mentioned, we are a doctor's office like any other doctor's office. We go to people, instead of people schlepping the office. However, our patients do not have to be homebound. If you have Medicare home health, those patients have to qualify for Medicare homebound status. Our patients do not have to be homebound. There's many patients that do use us for the convenience.
Going back just a second there, you mentioned, most doctors have about 5 to 8 minutes, and I was going to say 7 because I've done this research, and you were right on.
Yes,
no,
sir.
really, I've done the research, and the average.
And it's not their fault. It's not their fault. They're so pressed to see so many patients in such a little time that sometimes they have no choice.
That is true. Yeah,
it's sad.
And they're having to see more patients than ever to make the bottom line.
Yeah,
so
especially for seniors, our average patient's probably between 70 to 90 years old on about 8 to 12 meds a day, and multiple complications and multiple comorbidities.
Let me just ask you. So you have doctors involved with the program then that actually go out to the house?
Yeah. So we have doctors, nurse practitioners, and PAs that see our patients. Depending on the schedule and location, will depend on which is available. But we schedule patients just like a regular doctor's office, except we go to wherever they live.
That's great. That's a great option, especially, for someone who's homebound for whatever reason. Maybe even if it's a short period or a long period,
Temporary or permanent, correct. So we see all kinds of patients, whether it's for diabetes, COPD, CHF, multiple sclerosis. Many of our patients have some form of dementia, whether it's Alzheimer's or Lewy body, whatever it is. And the problem with a lot of the dementia patients, like Alzheimer's, is once you take them out of, even if they're okay health-wise, once you take them out of what they feel is their safe and secure environment, transporting dementia patients to a doctor's office and back and forth, the patient can become very belligerent and act out. And it's very difficult to transport them. So why not bring the medical professional to them?
And we've talked about on the show a lot with, sundowners, the end of the day kind of thing. Older people are on a schedule.
Yes.
For a reason, like you said, they feel very comfortable as well. So let me give out your information. I'm going to tell everyone about the areas you serve again. So again, it's Doctors House Calls. Great website. I got a ton of information there today. Y'all know that I love websites, and this is a good one. So it's just doctors-housecalls.com. Ton of info there. The number for Doctors House Calls is 888-606-0227, and I'm here with Seth Levy. He's MS, HFD, Ph.D. with Doctors House Calls as well. A couple of things that you also touched on that I was jotting down was how important it is, to know what's going on in someone's home.
Yes, sir.
As people get older, and this is important. We have a lot of people who watch the show, who aren't even from South Florida because, with video streaming
right.
and all these apps and everything. I know I have a listener even outside the country. But what I'm getting to is if you have a friend or family member who needs a house visit, this is a perfect opportunity to send doctors' house calls over. They can take a look. They can go check out the medication. I know that's one of the many things you do.
So you have a lot of what we call the sandwich generation. Maybe the children are living up in New York or New Jersey, Michigan, wherever, and their parents are down here. Well, so we get a lot of calls from family members, from mom and dad, that are calling about their mom and dad. They have their mom and dad down in Florida. They have their kids there that are in school and college, whatever, and that's why we call them the sandwich generation. And they live in New York, or they live in somewhere else that's not Florida, and they want to make sure that they're given good medical care. One thing too that I want to mention, David, is why have a doctor come to your home if you got to go out for something else, whether it's a blood test, whatever. So we're able to do literally everything in the home. So besides the medical visit, if that patient needs an EKG, a sonogram, an echo, a blood draw, x-ray, home health, physical therapy, whatever it may be, we're able to write it and have it done in the home wherever they live.
And even I read on the website, which I really thought this was neat, urgent care, and then also flu shots.
Right.
So it's not too late to get a flu shot.
No, it's not too late at all, and we definitely suggest that. So we basically have two types of visits that we have. We have our regular ongoing visit. We might see them, once a month on an ongoing basis. And then we have what we call sick call, where somebody calls us and says, hey, I'm not feeling well, or, hey, my mom fell last night. We really need to see what we do. We are not 911. We are not 911 in any way or form. We do not do emergent care. We could do emergent care, but not urgent care. So we can get out there usually pretty quickly, sometimes the same day, but usually within 24 to 48 hours. So if it's something serious, they need to go to the hospital.
And if not, it's doctorshouseCalls.com, 888-606-0227. I did promise before all the locations. I really like this, and I'm going to go off on a little about this. So obviously you're in Palm Beach County. You said Broward County as well. So Palm Beach and Broward. Neat thing is we have this show here. I rarely have anyone from the counties north of here. Yep. Martin County, St. Lucie County, and Indian River County. That's important. That is a resource right there.
The whole Treasure Coast we're able to service all the way up, think through its Vero, Sebastian, all the way up there.
A very big growing area.
Yes.
A lot of retirees.
Yes, sir.
It's a great area too.
That's for sure.
We talked about before. My dad lives up in Martin County, so
I want to make sure also that people realize. So we are a direct Medicare provider, as well as a direct Blue Cross Blue Shield provider. We basically, at this point in time, take all insurances except at this particular time we do not take any of the Medicare Advantage HMOs, but the PPOs, regular Medicare. We usually ask about Medicaid. Medicaid is the secondary. So if they're what are called one of the dual eligibles, Medicare, Medicaid, then yes, we do take that. For hopefully next year, we will be able to take some of the HMOs as well.
Well, it sounds like you know a lot about insurance and a lot about healthcare. If anyone has questions, it's 888-606-0227 or doctorshousecalls.com. You're going to do doctors-housecalls.com. And I'm going to give out that information a whole bunch of other times. Let's one more section before the break that I want to get into.
Please.
This is huge. And I've dealt with this with my own family. Medical equipment orders. You can help with that.
We do everything. Again, we're exactly the same as any other doctor's office, except we go to people. So whatever that patient needs, if they need a Hoyle lift, if they need a wheelchair, if they need oxygen, we're very, very welcome and very good at ordering. Now, remember that, to get those things under Medicare, you have to qualify. And one of the ironic parts, we work a lot with hospice also. And some of the hospices today do such a great job that when a patient stops declining, hospice will refer them back to us. And then if they decline again, then we have to refer them back to one of the hospices. So that's something to be aware of. But anything that patient needs, we are able to order for them and have it done and delivered into their home.
That is great. And it's Seth Levy with doctorshousecalls.com. We're going to take a quick break, and on the other side, talk a little bit more about everything they do at doctorshousecalls.com.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Probably talk about the hospitals.
Welcome back to the You and Your Doctor Living a Longer and Healthier Life show. We're talking here with Doctor's House Calls, Seth Levy. He's with the company, and they can make, visits to your home, office, hotel, also help with home diagnostic services. They do just about everything here in primary care. And I did want to mention the flu shot again, because I was actually watching the Today Show early this morning while I was on the elliptical machine. Wow, I finally said it right. It's not ecliptical, it's elliptical. I was getting a good sweat there, and I saw on the TV there, they're talking about the flu, and they said that, it hasn't even hit its peak yet this season. There's still time, especially, older people.
Yes.
And that it can also help with the general population getting the flu shot with younger people as well, because their immune system, I'm talking like, babies and toddlers, because their immune system is still building. So if you haven't got a flu shot, it's definitely recommended. All the boards, recommend it. The American Board of ... You look it up, it's there. So I know there's a lot of myths and everything going around, but it's better for the whole society if we all get flu shots.
Yep.
And, if you're getting the care of Doctor's House Calls, they can, bring the flu shot right to your home.
That's correct.
Your grandmother, your mom, your sister, your father, whoever it is that needs a little help.
So, I do, most of our patients are seniors, but not all of our patients are seniors. We can basically see anybody. We do have another division for people like David that are rich and famous for the private pay.
Oh, thank you. Someday. But private pay, yeah.
We are able to do private pay as well, besides the insurances that we take. So just, and we really don't have any specific age restrictions. It just happens that because we're a direct Medicare provider, that the bulk of our patients are seniors.
Yeah, and you said mostly 70 and over, but any age is fine.
We can see anybody. We
so
can see
this
anybody.
Could be anyone, who just had, surgery and needs the home care. Anyone who needs a doctor to visit, whether it's certain prescriptions they're on, just someone to check in. Again, like Seth said before, they can take a look at the house, because when people get older, there's a fall risk, and that's one of the
very much so.
A fall can cause so many more ailments afterwards. I mean, it can go really downhill pretty quick.
I mean, if you look at the statistics of when a senior breaks a hip, they don't last much more than 5 years after that.
Wow, that's
it's really a downfall.
Yeah, it can just be the catalyst that just starts a whole bunch of
It's like
of
snowball
issues.
downhill.
Yeah, definitely. And it could be just a little clutter in the house, and it's just maybe something they
A
don't
rug.
notice. And then again,
Could be
you said
anything.
about nutrition. You can watch what people are eating. That's an important part of getting better, right? Is nutrition.
100%.
Any doctor will tell you that.
100%. Nutrition, what they're eating. Seniors aren't they don't cook a lot. They, want to maybe grab something that's simple and easy. We've worked with companies, like a Meals on Wheels kind of thing to make sure they are getting nutritional meals. So everything is part of, keeping that senior aging in place where they want to age in place.
And one of the things you said before, I'm a writer. I'm always writing things down.
That's good.
Primary care extended was the way you described it. That's
Right.
really neat.
So we basically have seen everything under the sun. So someone will say, hey, I have a cardiac problem. I have a gastro problem. Whatever it is, 90% of the time, we're able to really take care of it pretty thoroughly. Now, next year, we're actually going to be able to be bringing on some specialists like cardiology that are also going to be able to do home visits. There's something that's called the CCM, which is chronic care management. Also, for severely ill patients, there's something called the RPM, which is remote patient monitoring. So the idea is keeping patients out of hospitals except for very severe things like an accident, an active heart attack, a stroke. Those things you need to go to the hospital. But just about everything else with today's technology can actually be done at home. Again, whether it's the chronic care management, remote patient monitoring, through telemedicine that's getting more and more understood and recognized and paid for in many situations. So these things that we're going to be bringing to fruition will be able to let people age in place in their homes with their loved ones.
Yeah, and with great care, they hopefully live a little bit longer than people years
Right. And
ago.
not just the longevity, but also the quality of their life.
Quality of life. That we always talk about that on the show. Thank
Longevity
you
and
for
quality
mentioning that.
have to go together.
That is
And that's what we strive for. One of our claims to fame is being able to work with hospitals to significantly reduce their hospital readmissions through something called the TCM visit, which is transitional care management, and working with hospitals, reducing their frequent flyers to the ERs. I learned an amazing statistic that 76% of the 911 calls are not actually 911. They're not emergencies. And most of these things can be taken care of in the home.
wow. That's a huge amount. Wow. Then
76%.
it doesn't clog up the hospital, emergency rooms, etc. When it's just maybe someone just doesn't know the answer or doesn't know if this is something that needs to be
Right.
moved up the chain further in medical care. But they can call you, and
Yep.
like you've said, you've seen it all. You've been in all these houses across South
Amazing.
Florida.
I'm very old. I've been doing this a
Apartments.
long time. And I was actually the director at the first mobile physician group in the state of Florida called MDTU. We had over 5,000 patients, and I was very proud. We had 22 people over the age of 100. So that was kind of nice.
That's great to hear. Wow,
Yeah.
people are living longer. That's great. And it's all
That's
about
for sure.
quality of life. It's, again, doctorshousecalls.com. You can put in your browser, doctors-housecalls.com, just like that. Google it. It comes right up. Their number is 888-606-0227. Seth Levy was telling me you can make the appointment either by phone, or if you'd like to just from the comfort of your computer there, wherever you are, you can make an appointment there, which is great. And one other thing, since we have a few extra minutes, we've really ripped through a lot, which is great, which gets me to this. We've had 3 hospital CEOs that I can remember right now that sat in that chair. And one of the things you can help, and you touched on it briefly, is with reducing hospital admissions. Tell
Readmissions,
us,
right?
Readmissions, I'm sorry.
Yeah.
Readmissions. Reducing hospital readmissions. I got a little ahead of myself. Tell me about how things are changing from that 30 to 90 days like we were talking about briefly.
So right now in the United States, when a patient comes back into a hospital, in 30 days or less, the hospital's fined. The average fine last year was about $200,000 per hospital per month. Next year in 2020, the time is going to go from 30 days to 90 days. So if a patient returns to a hospital in 90 days or less, the hospital is going to get fined. And we, as a mobile physician group, are able to significantly reduce those hospital readmissions and save that hospital hundreds of thousands of dollars, and it does not cost them one penny.
That's great news, because that's going to help their bottom line. And, we need hospitals in our community.
That's for sure.
Especially, for the stuff that gets,
It's very severe.
There's the word. Perfect. Again, it's doctorshousecalls.com. You touched a little bit on your experience, but let's talk about more your experience and how you got involved with Doctors House Calls.
I was actually, in another life, I was a teacher that got recruited down here to run a program in Pasco County for at-risk children. And then I was recruited to the East Coast to run a program at a place called West Riviera Magnet Elementary School, to run a similar program there for at-risk children. And then I've been always into health and wellness and fitness. And then I was recruited into the healthcare business, first in home health, and then got recruited to, as I mentioned before, the first mobile physician group in the state of Florida.
That's great. And how many years has that been going on?
I've been in the mobile physician industry now for almost 20 years.
Wow, 2 decades.
Yep.
Unbelievable. And I was the first Mojo journalist in Palm Beach County, mobile,
Very
where
cool.
I just had my laptop, computer, and
Neat.
phone that they gave me, and I was
A lot
just
in common, David.
back in the day, I just used to report right from the streets of Delray Beach. So
Nice.
that's my
Nice.
claim to fame. So
That's awesome.
neat. I knew we had a lot in common because we connected. And big shout out to Charles Felix. We've met there, South
Yes.
Florida Healthcare Networking Group. It's part
Great
of
guy.
South Florida Hospital News, meets monthly at a different hospital. I love this. It's not about competition. We meet at different hospitals. We may be at an HCA hospital, maybe at a Tenet Health Hospital, etc. Baptist Health. But we all meet every month, and we talk about we get a couple minutes
How we
to
can
talk
help
about
each
ourselves.
other in teamwork.
Yeah, network. And that's where we met.
Yeah.
I'm so happy to have you on the show.
My
we got
pleasure.
about a minute left, so let me give out the info one more time. It's doctorshousecalls.com is the website. The number is 888-606-0227. They can help you out with home visits, in-home diagnostic services for primary care. If you have any questions, Seth Levy knows a ton about insurance, Medicare, great source for you. So I want to thank you, Seth, for coming on the program.
My pleasure, David.
And
You're a great host.
Thank you.
Greatly
I appreciate it. And I learned a lot here today. We touched on a lot, but if you have any questions, check them out. Again, doctorshousecalls.com. And we'll see you next time on the You and Your Doctor Living a Longer and Healthier Life show. And have a great evening, everyone.
Thanks, everybody. Be well.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.